Today we are going to look at the stages of the arousal of sleep. So we have first two questions. The first question is, in case of relaxed drowsiness, what is the EEG finding? And the second question, in case of NREM2, what is the EEG finding? So in this video, we'll find the answers to these questions and learn in detail about this topic. So to begin with, there is a stage known as the alert. There is alert wakefulness. So in case of the alert wakefulness, we look at the behavior and then the EEG findings. So how is the behavior? The behavior, if you see, the patient is awake and there is a alert. The person is alert and this is with the eye open. With the eye open. So the eye is open. So then we look at the EEG findings. What is the EEG? So the EEG is nothing but there is a beta. There is a beta rhythm. And what about the hertz? It's about 14 to 30 hertz. Next, we also have the stage of the relaxed wakefulness. We have a stage of the relaxed. There is relaxed wakefulness. So under the relaxed wakefulness, there is the behavior. So under behavior, in case of relaxed wakefulness, the person is awake. Then the person is relaxed as well. The person is relaxed. And what happens to the eye? In alert wakefulness, it is the eye is open. Whereas in case of relaxed wakefulness, the eye is closed. So you can say the eye is closed. So what is the EEG finding in this case? So in this case, the EEG finding, it is mainly the alpha rhythm. It is mainly alpha rhythm. And it is about 18 to 13 hertz. And the next point is, it changes to the beta rhythm. It changes to the beta rhythm. So it changes to the beta rhythm in response. It changes to the beta rhythm in response to the internal and the external stimuli. Internal and the external stimuli. Next, we will look at the stage of relaxed drowsiness. In case of relaxed drowsiness. So in case of relaxed drowsiness, the behavior if you see, the individual remains fatigued. So there is a characteristics of fatigue and then the person is also tired. And the head, if you see the head, it droops. The head, it droops. And then there is also the momentary lapse. There's momentary lapse of attention. The other thing to note is that the person is sleepy. The person is sleepy, but is not asleep. So what are the EEG findings in case of the relaxed drowsiness? So here the EEG findings, it tells us that it is a decrease. There's decrease in the alpha wave. There's a decrease in the alpha wave amplitude and also the frequency. So there's decrease in the alpha wave amplitude as well as the frequency. Next, when we look at the NREM, so we look at the NREM1. So in terms of NREM1, what is the behavior? The behavior here is that there is a light sleep. Individual experiences a light sleep. And here the patient is easily aroused. The person is easily aroused by the moderate stimuli. By the moderate stimuli or even by the muscle jerks and there is a continuous NREM1, there is a continuous lack of awareness. Then we look at the EEG findings. So what is the EEG findings? So the EEG finding here is that there's a mixed frequency waves. It has a mixed frequency waves, and this is about a predominantly 2 to 7 Hertz. Next, there is also a gap. There's a gap. So where is this gap? The gap is in the alpha rhythm. The gap remains in the alpha rhythm, is filled. The gap in the alpha rhythm, it is filled. So this gap is filled. So it's filled by theta. It's filled with the theta, and this is about 4 to 8 Hertz. And also there is something known as the delta. So delta is nothing but slow. It is slower than the 4 Hertz. It's slower than the 4 Hertz activity. Then in case of the NREM1, we saw there's a mixed wave frequency, there is a gap in the alpha rhythm is replaced by theta, and now we have something known as the vortex waves. Vortex waves. Next we move on to the NREM2. So NREM2, it accounts to about 50 to 60%. And how is the behavior in this case? The behavior is that there's a further lack of sensitivity. There is a lack of the sensitivity. There's lack of sensitivity to the activation, lack of sensitivity to the activation, and also the arousal. So how is the EEG findings in this case? So looking at EEG, there is a predominant. There is a predominant theta activity. There's predominant theta activity, and this is about 4 to 7 Hertz. And in NREM2, there is also a K complex. There is something known as the K complex. This is in NREM2. So there is a K complex. So this K complex, as well as there is a sleep spindle. And they occur periodically. K complex and the sleep spindle, they occur periodically. Then we also look at the NREM3. After the NREM2 comes the NREM3. So this accounts to roughly about 20%. And how is the behavior? The behavior is that the person undergoes, there is a deep sleep phase. The person has deep sleep. And there is also the arousal. So the arousal is only with the vigorous stimuli. The arousal is with the vigorous stimuli. And there is also a sleep arousal and sleep. In case of sleep, the arousal is most difficult. The arousal is most difficult. Then we move on to the EEG findings. So in case of the NREM3, the EEG findings is that the delta is greater than the theta activity. Next we move on to the REM. So what is the REM? So in case of the REM, it is nothing but the paradoxical sleep. So this amounts to about 25%. And how is the behavior in this case? So the behavior, there is about 50 to 90 minutes. That's 50 to 90 minutes. And this is after sleep onset. It is after the sleep onset. And the episodes repeated every 60 to 90 minutes. So it repeats. The episode repeats every 60 to 90 minutes. And each episode, if you see, it lasts. So one episode will last for 10 minutes. So one episode is equal to 10 minutes. And dreaming. So the dreaming occurs along with the rapid eye movement. So there is rapid eye movement as well. So rapid eye movement is also present here. There is increase in the brain oxygen consumption. There is brain oxygen, if you see, the consumption is increased. Next we look at the EEG. So how is the EEG? So the EEG, it resembles that of the alert awake state. So it is similar to the alert awake state. And there is also a sawtooth. There is a sawtooth appearance. Sawtooth appearance is seen in case of the EEG of the REM sleep. Now we will jump to answering our question. So the first question we asked was, in case of the relaxed drowsiness, what is the EEG finding? So in terms of the relaxed drowsiness, the EEG, there is a decrease. There is decrease in the alpha wave. There is decrease in the alpha wave. So what in the alpha wave? The alpha wave amplitude as well as the frequency. Then the second question we asked was in case of the NREM2. So NREM2, we need to know that it is about 50 to 60% of the sleep. This is NREM2. So here it is the EEG finding shows a predominant theta. There is a theta activity, predominant theta activity. And this is about 4 to 7 Hertz. And there is also the K complex. There is a K complex and sleep spindle. There is a K complex and the sleep spindle. So they occur, you can say they occur periodically. They occur periodically. To grow daily, please do subscribe.